Hi members, Jennifer Morrish here again. Today we are very pleased to have Senator Dan Morrish, who is out of Lake Charles. He sits on the Environment Committee, Natural Resources, but most importantly, he is chairman of the Senate Insurance Committee. So Senator, thank you very much for taking your time to spend with us today. Also, I want to thank you and the members of your committee for joining us at dinner last night. Members, we had a great dinner with some of our Platinum and Diamond Land Pack members meeting with the Joint Insurance Committee for dinner last night. And again, thank you for that effort.
I know, thank you. It
Yeah.
was wonderful, great experience. I think the committee members thoroughly enjoyed it.
Now, Senator, let's go ahead and start off with the big elephant in the room. I know you're very familiar with balanced billing. We at the LSMS, of course, feel to not
That's
allow...
the first time I've ever heard that word.
Oh, I'm sure it is. I'm sure it is. That to prohibit a provider from billing for their services is effectively rate setting and should not be allowed. I know several pieces of legislation were filed and have been assigned to your committee. Can you tell us if you've got any feel for the mood of your committee on the issue, and also if you have any kind of timeline when those bills might be scheduled?
Of course, you know, balanced billing is against the law. And so I think that's the wrong term. You know, it's outside of the network is what the issue is, because we don't balance bill in this state. It's against the law. Your members don't do it. Hospitals don't do it. You know, but outside of the network is the issue. It's called balance billing, but it's a wrong term. But I think there's a couple of bills out there. I believe Senator Heitmeyer has one. I believe that's the only one that's coming to my committee. He may have another that's going to be in his committee, but it's the only one, and he has yet to schedule the bill. I think he's trying to work through his committee, but he has told me twice that he may still be coming to my committee. It's getting a little late. I would expect, if not next week, the week after, if he decides to bring that bill to our committee. On the pulse of the members of my committee, it runs the gamut. I think there's, as with me, I think there was something that the committee would like to do. Matter of fact, I think the whole legislature would like to be rid of this issue. But we've been working on it for, Jennifer, 15 years, maybe at least, and when the best we've been able to come up with is bold print when you go to the hospital, you know. Exactly. So it continues to be a problem. In some areas, it's not as big a problem as it used to be in Lake Charles, where I'm from, you know, because a lot of the docs now work for the hospital, so there's not as many of those issues of outside the network. But it continues to be an issue across the state, especially with emergency room. It's also an issue with the Commissioner of Insurance. One of his big points and one of his big agenda items is balanced billing and outside the network. So I don't think it's going to go away. And I wish I was smart enough to have the answer, but I don't.
Now, bills that expand the scope of practice for non-MD healthcare providers always seem to pop up. Can you talk to us in general about some of those expansion of scope of practice issues that are before you this year?
You know, I'm very concerned about those scope of practice issues, and I've been very concerned about them for years, because if it hasn't been, you know, it's always been, you know, the anesthetist and the anesthesiologist, you know, the optometrist and the ophthalmologist, and you know, it goes on, the nurses, nurse practitioners, and the docs. And they expect the legislature to try and solve that, and they're the real professionals. So, you know, in that regard, I would encourage your members to step up, and I think they have. You know, they have been a little bit on the sidelines with you. This year, I think they've stepped up and said, you know, there is a line in the sand here that I agree with. I think there are always opportunities or situations that present themselves. For instance, I represent a large rural area. Nurse practitioners do a good job in our area. All the nurse practitioners, though, in my area that are practicing today are practicing under a doctor, and I think that needs to continue. My concern is there aren't a lot of physicians that want to do that, that can take the time that from their practices to participate in that. So I want to make sure that there is that continuity If one physician that's doing it now leaves, where does that leave that nurse practitioner? And there needs to be some safety net for that practitioner in those areas. So, the optometry bill, I believe enough is enough. There's just so far you can go with those issues before you go to medical school and become a physician in practice. So I think there's some lines that have been drawn, and I think it's probably time that those lines were drawn.
Your LSU hospital in Lake Charles, Moss, was one of the first to close its doors under the realignment of care throughout the state with the charity hospital system. Your hospital also was extremely unique in the level of outpatient care that it was providing. Can you talk to us about some of those fundamental challenges that may have arisen because of the change in healthcare in Lake Charles?
Worked out great. And when you talk about the first one to close, for all practical purposes, Moss has not functioned as a hospital since 1985. It actually closed in 1985 and reopened again a few years later as with 10 beds with a lot of outpatient services, and it expanded those outpatient services throughout the community. So it's had an emergency room. It hasn't had an emergency room. So people have been, a little, they love it for the outpatient, but the emergency room situation was never solved. With the Memorial and Women's and Children's takeover, if you will, merging with Moss, it took a while because people thought Moss was closed. You even said, Moss is closed. Well, Moss isn't closed. Moss is opening under another name. It's open. It's doing business. It has I think it's an 18-hour urgent care clinic, which people have yet to get used to. So initially, our private hospitals in Lake Charles were getting a lot of emergency room visits. It has dwindled now that the community knows what is at Moss. And I think they've really bought in. Memorial and Women's and Children are doing a really wonderful job. The employees have been happy. I think in the whole transition, I think the number of employees that actually left were less than 20. And they stayed on with Moss, with Memorial, who have been a really good employer, benefits the whole 9 yards. So it's working well.
I know you also have some big challenges ahead in Lake Charles, not only with workforce development, but because of the boom in the economy. You've got a lot of jobs that are going to need to be filled, but on the same front, you're going to have a lot of new people that are going to need their health care needs taken care of. So what are you hearing in the community? I know you've been having a lot of meetings, especially in your role as business manager for the Lake Charles Pilots. You folks have a lot more work ahead of you as well. So what is the feel of the community about how they plan to face these challenges?
Lots of challenges. And I'd have to say that there's a group that's been formed in Lake Charles through the Chamber of Commerce called the GROW Group, who is trying to address a lot of those issues: traffic, infrastructure, the ship channel, workforce development issues, housing. I haven't heard him mention medical care, though, so it's something interesting, and I'll bring that back to him based on this interview. I appreciate that. I do, and they may have addressed it, with the local hospitals. I know that what was Women's and Children's has now changed their name to Lake Area Medical Center. They've expanded their scope of practice to a full-blown hospital. There's a private group that's coming in with another boutique type hospital, mostly for orthopedic issues. So West Calcam Hospital has expanded considerably. The hospital in Cameron, as you know, we rebuilt after Rita. It has struggled. It's now offering some outpatient clinics with help from Chenier. So all of that being said, I don't know though if there has been a focus on healthcare. I know that some of the proposals from people who were going to do housing and transportation for the construction workers planned on building some clinics, or at least urgent care type clinics. Now that's what I see in Lake Charles. Tremendous amount of urgent care clinics going up, but I understand that's in just about every other city in Louisiana. So a lot of that access is going to be available. But just for that point, I don't know that it's been addressed. It probably needs to be looked at a little closer. But the ship channel in Lake Charles and my job with the pilots is going to really get interesting here in the next couple of years. A lot of growth.
I bet it is. Well, Senator, again, thank you so much for your time, and we will see you in Senate Insurance Committee.
Jennifer, I appreciate y'all. Appreciate what Jennifer does here. She does a great job, along with Greg Waddell, who I worked with Greg when he worked here for the Senate, when he worked for Senator Mount from Lake Charles. So we appreciate the staff y'all have assembled, and the contact that you have for us. I think y'all have improved that since you've come on board. I see a lot more contact between legislators and your organization, and I appreciate it a lot. Thank you very much.